Okay, so it's my honor to celebrate with you the 150th anniversary birth of a father of nephrology and hypertension, Franz Volhard. So, who is Franz Volhard? Franz Volhard was a German clinician who was both a pioneer in the field of nephrology and hypertension. He was born in Munich, 4 to 7 children. He graduated in HSA in 1897, continuing his prolific academic career with a doctorate and more than 200 publications. So he worked in many hospitals during his brilliant career. He worked at the pathology department of Bellinghieri in 1897-1898, and immediately after at the Medicine University Clinic in Jesse. During his outstanding career, he led departments of internal medicine at the Luisen Hospital in Dortmund and in Mannheim. Afterwards, he was appointed full professor of internal medicine at Holland der Saale and director of the University Hospital Frankfurt am Main. So in 1931, he published one of his most important works, the publication Kidney and Urinary Tract. During the World War II, Volhard was under attack from Nazi regime. In fact, he was forced to leave the position of Dean of the University Hospital of Frankfurt am Main. Only in 1945, after the end of Nazi tyranny, he came back to his position of director. He dramatically died in a car incident at the age of 78. So he made a great collaboration with another important scientist, Theodor Farr. In their monograph, The British Nephritic Clinic Pathology und Atlas, Volhard and Farr divided the right disease in a classification with three different forms: the degenerative disease or nephrosis, the inflammatory diseases or nephritis, and the arteriosclerotic diseases or sclerosis. So the arteriosclerosis diseases group was categorized into simple venous sclerosis and the combination form, the combinatory form. Farr further divided the venous sclerosis into the compensated and the compensated form, according to the presence or absence of glomerular involvement. Volhard and Farr also coined the term renal insufficiency, in substitution of the term contracted kidney. So Volhard and Farr distinguished two groups of hypertensive patients with nephrosclerosis. A group of benign nephrosclerosis with patients with hypertension of long duration. The deaths of these patients occurred in most instances from cardiac or cerebrovascular diseases, and kidney failure was in general not too severe. They wrote, proteinuria may be completely absent in benign nephrosclerosis over many years and may develop all in phases for years. The second group was the group of malignant nephrosclerosis. So the patients clinically were characterized by an excessive rise in blood pressure, neuroretinopathy with or without papilledema, albuminuria, hematuria, progressive impairment of renal function, and weight loss. So they described the morphology of malignant nephrosclerosis by severe degenerative changes of afferent arterioles, proliferative alteration of interlocular and arcuate arterioles with the typical onion skin alterations, as well as inflammatory and degenerative reactions of many glomeruli. So Volhard differentiated between the pale and red form of hypertension. The pale hypertension was described as general vasoconstriction, as documented by pallor of the skin, narrowed retinal vessels, as well as hypercirculation of the kidney. Red form was defined as a reflection of essential hypertension, initially with no signs of enhanced peripheral vascular resistance were found, while red vessels compliance was assumed to be decreased. So he underlined the influence of inheritance, age, obesity, lifestyle, as well as alcohol abuse in its pathogenesis. So he also assumed that hypertension in acute and chronic renal disease is a consequence of diffuse involvement of renal vessels. He said that it is undisputed that with acute diffuse glomerulonephritis, also glomeruli of both kidneys are found, so to speak, empty of red blood cells, not secondly also the vasa afferentia. In 1942, Volhard wrote, if the humoral mechanism of renal-induced pale hypertension adds to red hypertension, high blood pressure is henceforth to be described as malignant. The progressive course of renal insufficiency is unavoidable, since the humor caused generally a renal vasoconstriction will further aggravate the disturbed circulation in the kidney. A true vicious cycle, just as with chronic nephritis, whose progression is to be understood only in this manner. Evident is the visible change of the background arteries of the eye, the later development of vascular changes, including thickening of the arterioles, could finally result in the development of pale hypertension. So he defined a contraction of the kidney vessels. He said that only some isolated glomeruli are still filled with blood in this condition. I have reason to assume that a contraction of the kidney vessels is a primary factor or functional occurrence. Supporting this is the fact that, after dying, the glomeruli are easily filled with, and the vasa afferentia are often found empty of blood. So here we have a case record that he reported in his monograph. A case of a 45-year-old merchant who consulted with his physician for several days. Urine investigation was initially normal, and only after there was the onset of albuminuria. There were no red cells or active sediment, and the systolic blood pressure was really high. The patient died 3 years after his first symptom for lung edema. At autopsy, shrunken kidneys, heart hypertrophy, severe cerebral and coronary atherosclerosis. We have a bigger magnification here, where we can see the inflamed glomerulus with the proliferation of endothelial cells and the formation, migration formation. There is also febrile precipitation and a marked hyaline thickening of the vas afferens. So another point of Volhard points of view for chronic kidney disease was the motto, starvation, thirst, and bed rest. At the Congress of Internal Medicine in Warsaw in 1916, Volhard presented the treatment approach of starvation, thirst, and bed rest, with an instructional pamphlet of the diagnosis and therapy of acute nephritis. This novel concept helped to reduce the mortality rate of nephritis in both World War I and World War II. He also stressed out the concept of the dietary therapy for renal diseases. So Volhard extended the dietary therapy also to hypertensive patients with chronic nephritis, recommending a low-sodium diet. In that time, there was no efficient diuretics without toxic effect. So he also stressed the role of a restriction of fluid intake. He stated that in patients with diffuse nephritis and with a permanent hypertensive state, I have never seen a measure of such benefit as dose reduction of fluid intake, which I recommend to relax the circulation and to disorder the heart. Its performance is extremely facilitated by a vegetarian diet. He also proposed a definition and therapy of uremia. So he classified uremia into two main classes: the true uremia, that is resulting from the retention of products normally excreted by the kidney, and the pseudouremia, with symptoms unrelated to renal impairment. So for the therapy of true uremia, he recommended a low-protein diet, in particular vegetarian, with a normal caloric supply. He wrote, in patients with chronic renal failure, it is possible to postpone the increase in the serum urea concentration for a long time by reducing the daily nitrogen intake to 20-30 grams of proteins. Sometimes we succeed in reducing even considerably high serum urea concentration. Consequently, uremic symptoms disappear. So now the words of a Nobel Prize, Albert Husey, that he described with these words the Volhard's work. Much credit is due to the indefatigable investigations of Volhard, who was convinced that a vasospastic factor existed in the so-called hypertension, as was indicated by ocular and cerebral symptoms, and by blanching of the vessels of the skin. Since he believed that the exaggerated contraction of these vessels was due to a substance circulating in the plasma, he devoted himself, with the help of his students, to a search of its presence. Volhard during his career had a lot of honors, many doctorates, many medals, but also several clinics, awards, and awards. Among these awards, there is the Franz Volhard Award. So the worldwide medical community highly appreciated the scientific contribution of Volhard. They constituted the Franz Volhard Award for the International Society of Hypertension. The first prize, the first award of this society was given to Sir George Pickering, that winning this prize dedicated this award to Franz Volhard. One of the most handsome and the most impressive men that I ever met. Outstanding was his zest and joie de vivre. He noticed everything. If it was good, enjoyed it hugely. So Franz Volhard has been a pioneer in nephrology and hypertension field. His contribution to the knowledge of hypertension and renal diseases treatment have been greatly appreciated by the scientific community worldwide. His devotion to research and clinical practice represents a bright example of a scientific mind open to progress. Thank you.